Hello, everyone. Welcome to another episode from CRA Arthritis in Quebec City, ACE's 9th consecutive program at this Canadian Rheumatology Association and Canadian Arthritis Health Professional Association's annual meeting. Very pleased to be here. I'm Kelly Lendvoy, VP of Communications and Public Affairs. And we have a friend of ACE's joining us today, Dr. Sasha Bernatsky, a very esteemed and leading rheumatologist in Canada, the James McGill Professor, the Department of Medicine at McGill University. Dr. Bernatsky, welcome.
Thank you.
And you are representing a couple of topics at this year's annual meeting. We're going to focus in on one of them, and it's on, I think, a really interesting subject area for our audience to learn more about, and that is this whole issue around air pollution, and is it possibly a cause or determinant for inflammatory arthritis, particularly rheumatoid arthritis. Just as a background, I should add for our audience that some of them will know that we've been covering this topic in terms of research highlights from both the American College of Rheumatology annual meeting and the EULAR annual meeting. And in 2021, we did cover a couple of studies, one from France that looked at passive smoking, and also one from Italy that looked at pollution and how it possibly affected biological treatment. So there is sort of that background, and I know you might want to comment on that because you're probably familiar with those. But let's focus in on your work and tell us what you're presenting at the meeting today or tomorrow.
Thank you. So yeah, it's a poster presentation, but I think it's a really interesting topic. So for 10 years now, I think, I've been interested in this topic of whether it is possible that air pollution might be in some way triggering or maybe affecting either the onset or outcomes in various rheumatic disease conditions. So mostly interested in rheumatoid arthritis and systemic autoimmune rheumatic diseases because of this idea that air pollution could be perhaps an inflammatory stimulus. So if you look back on the earliest publications of air pollution and health, people focused on things like asthma because it made sense. If you breathed in air pollution, you would trigger asthma attacks or, worsen asthma outcomes, including mortality, and that certainly has been shown. But then reports came out of associations that were apparent between air pollution and cancer or overall mortality or circulatory outcomes, cardiac events. So it really seemed it was time to start looking at the question of the potential effects of air pollution on rheumatic disease outcomes. And as I mentioned, when air pollution in the respiratory system is very inflammatory. And it turns out that some of these substances in air pollution that we can't see because it's so tiny can actually enter not just into the lungs, but be in a way absorbed into your system. So these fine particulate matter substances, which are less than 2.5 micrometers, can get into the circulating system and actually stimulate inflammatory cells and the cascade of cytokine production and downstream events. So my group was one of the first to start looking at different data sources. So we'd use some of the Canadian administrative health data sets that are so useful, looking at billing codes for different rheumatic conditions and linking that up to different records of air pollution. And so in Canada, we have different ways that we can look at air pollution, from monitoring systems that are set in place by Health Canada. Mm-hmm. And our earliest studies kind of looked at those exposures and indeed did see some associations between air pollution exposures, especially this fine particulate matter, PM 2.5, and the onset, or at least the existence of systemic autoimmune rheumatic diseases, so things like systemic lupus, scleroderma, myositis, that kind of group of conditions. More recently, we've also used data from CanPath, which is a very large effort with over 300,000 Canadians from all across Canada who provided information on their health status and then linked up to administrative data and also provide biosamples. So we actually were able to show that air pollution markers, and here we were using more some satellite imagery that we could talk about in a minute, to show that you could take the biospecimens of people who didn't have necessarily rheumatoid arthritis, but demonstrate that anti-CCP antibodies were more likely to occur if you were residing in an area where there was more exposure to things like PM 2.5 air pollution. So I'm sorry for talking so much, but I really find it fascinating.
It is, and I think, in terms of knowledge translation, I think our audience, some of the questions they might have is, what did you define as a riskier environment? So obviously, if you're looking at big cities, were you looking at mid-sized cities as well?
So we looked at exposure in different ways, and there's no perfect way. So I mentioned that in the past we used these monitoring data from these monitoring stations. So there's these monitoring stations across Canada that can measure how much carbon dioxide or sulfur dioxide or PM 2.5 is present, but they're only available in major cities. So that's why we moved on to more sophisticated efforts like the satellite imagery, where there's many researchers in the pollution and health outcomes arena that has spent a lot of time and effort creating models where they can use satellite images and correlate that with things that air pollutants that are monitored on the surface, and come up with estimations of people's exposure to different air pollutions, not just in the air pollution components, not just in the cities, but all over. So for me, that was useful because some of our earlier efforts had to really focus on the more urban areas.
Sure.
Now, if we had to step back and ask, okay, so I live in downtown Montreal, should I be moving out to a suburb or should I move to a small town? So it turns out that within a place like Montreal or maybe Toronto, within a certain region like Montreal, probably like whether you live right in the middle of Montreal or in NDG, a suburb where I live in, you're probably exposed to roughly the same amount of PM 2.5. One, and other constituents of air pollution too. One caveat would be probably it's not so good to live close to a major roadway. So, I mean, I don't want to scare people who happen to live close to a major roadway, but if there's quite a bit of evidence that living close to a major roadway confers more exposure to particulate matter and other forms of air pollution, and possibly worse health outcomes, including maybe rheumatic disease conditions.
Now, that brings up, I think, some interesting socioeconomic considerations. It's so interesting that, what we've heard over the last few years as it relates to extreme weather and climate change is that there are populations in a city more affected than other populations who don't have access to green space and shade and cooling opportunities. It would seem to me we almost have the same situation here, that what you're describing, if possibly lower income or race could be coming into a factor here if they're living in these neighborhoods that have a higher degree of pollution.
What a great observation, Kelly. Like, it stares us in the face, doesn't it? Like when you think of who's living next to a major roadway, often it's a neighborhood where the real estate is lower priced, and a lot of the factors that you just mentioned, like education, kind of like lower education, perhaps lower employment opportunities, lower income, all of those, they travel together. And you're right, like those vulnerable populations, they're at risk from so many perspectives, right? As you mentioned, from climate change issues and even the whole COVID pandemic, right? So I think they're all pointing to the same fact that we need to try to think of some way to help maybe level the playing field.
So, and then I think, our audience are probably thinking maybe of other cities in other countries in other parts of the world. So, do you have international colleagues who are looking at this in Sao Paulo or Beijing or Delhi or Los Angeles, where we know obviously every day those people are living at risk from the pollution? Are they doing similar type of work, and are they finding similar conclusions?
Yes, indeed. This again is really important because you'll see a lot of air pollution studies coming out from China and other areas as well, but they have pretty good administrative data also in a place like China, where they can use administrative data to look at potentially adverse effects of health pollution. When we were asking for funding from the Canadian Institutes of Health Research for this program of research, one of the questions that came up from reviewers was, well, like in Canada, we don't have that much air pollution, so is it really going to be important? And I think it's really eye-opening to know that even though we have it pretty good in Canada, you can still see some health effects of air pollution, so it's like there's no safe exposure level.
So if people want to find out more information, we're going to be able to share your paper that you're presenting here this week in Quebec City. They'll be able to look at that. Are there some other places where they can go to get more information on this topic?
So that's another good question. I'll have to put together maybe some links that would be good for a lay-friendly audience.
Great, that's fantastic.
Okay.
All right, well, thank you very much for joining us again, Dr. Bernatsky. We're always pleased when you can share some time. We know it's a really busy week for you in terms of your meeting other colleagues and then obviously making presentations. So we really appreciate you joining us.
Thank you. It's an absolute pleasure.
Thanks again.
Thank you.